can be done in order to fix that problem. So we're looking into it, and we'll be probably coming up with some sort of resolution sometime, maybe even by the finance committee.
Anyone else? Seeing none,
Joe.
Mr. Chair,
go ahead, Mr. Reagan.
question for Heather. There's been some discussion about the placement of some of the foster care children with social services employees. What's your, I'm sure that you as the acting commissioner have looked at this situation, and I would like your opinion on whether or not it's necessary and useful to the department to have them continue to do that.
Mr. Reagan, if I could, Heather, would you hold off for just a minute?
Yep.
That conversation is taking place. Rather than do it in this forum, having her respond to that, I would appreciate it if you could hold off on that request. There's a meeting tomorrow with social services, with county administrator, that will be taking place, and that will be discussed.
Okay.
In addition to that, we've hired an outside agency to take a look at this. And rather than comment from just our side that's going to get out into the public, I would much rather wait and see a response from the Bonadino Group, an independent agency that will be giving us their recommendations. So I hope you would go along with that.
That's certainly appropriate, and I'm glad that that's taking place. And hopefully there will be a recommendation from the organization that we've hired after a careful review has been made of the current situation.
Well, you can rest assured that they will be held to that.
Thank you.
Recommendation. Heather, unless there's anything else, and Mr. Button, unless there's anything else from you, your part is done. And we'll move along to Mr. Ulrich. You have, wait a minute. Nicole, you have a question?
I did very quick. Yep, just very quickly for Ms. Rand, before you get off. So CPS right now has an average caseload of 24. How many new staff are we onboarding that will be able to take cases soon? And if our numbers remain the same, about how many cases will that bring them down to per staff member in CPS?
Well, let me see. So our some of our trainees actually just finished their training period that was in the middle of October. So unfortunately, we're still trying to kind of get over that hump. And we received a resignation this morning as well. So as we move one step forward, we kind of go one step back. So we are going in the right direction. As far as specific number of new trainees for CPS and when they'll be ready to go, I can get that specific information back to you. It looks like our next group will not be finishing their training until later on this year. But I don't want to speak out of turn and think that we might have some being done earlier. We are certainly moving in the right direction, but as I said, I think at the last meeting, as long as we don't lose anyone, we'll be fully trained and ready to go by the end of the first quarter in 2020, and we've lost 2 since then. So.
And do you continue to do exit interviews on the people that are leaving? So we're gathering that information to find out why they're leaving? Yeah.
So we have, I did an exit interview with the gentleman who left. He took another job for a service organization, and We have actually one of our child protective staff, last day is today, and we received a resignation today from foster care preventive worker. So continuing to hear the same things, the caseload size, stress, and inability to, one individual specifically noted difficulty with keeping up with the work because of the caseload sizes. So again, you know, if we can get to that point where we're where we need to be, I would hope that it will help with retention as well, for sure.
Great, thank you so much.
Mr. Burke?
Heather, do you know offhand, Heather, how many caseworkers we have right now on the child protective side?
I want to say 30, but I was going to check. I was going to count just to check, and I know, like I said, that we're losing one today. So I believe our number was around 30.
Do you know how many we would need to have caseloads no greater than 15? Ballpark.
Well, I mean, ballpark, what I would do is take the total number of cases, divide it by 15, and then see what we had for a number. So the simplest way to look at it would be to take the 620 divided by 15 and see what the number is, understanding that not all cases are the same. And again, if we can kind of get over this, continuing to lose people, trickling out, we can continue to kind of go in the right direction.
That's just doing the math roughly, it's about 41 caseworkers we would need, just a little over 41 to, and that would be if everybody had exactly 15. Wouldn't factor in the training time that you need for new employees. And how many staff do we have in the pipeline right now? How many new staff have been requested and approved? Do you know, Heather?
We're still hiring. We still have some individuals to hire, and we have some backfill positions because of the people who have left. We have at least 5 in training right now. So we have, I don't know the exact number. I wasn't prepared to answer that, but I would say that we have, 5 to 6 currently in training. I think at least 4 new positions that we're still in the process of hiring, and then the backfill for, it would be at least 3 positions.
The 5 or 6 that are in training right now, are they part of the 30?
No.
Not. So we would be picking up maybe another 10 to 12 positions.
Yes, not all in CPS though, not all child protective. So I was speaking to child welfare in general.
Okay.
Some of those people in training are not identified for child protective. And some of the replacement positions are not child protective as well. So.
Okay. Thanks, Heather.
Anyone else? Mr. Sheridan?
Mr. Chairman, I just want to, I misspoke earlier this evening when I was telling you about, when I was addressing the group, telling them who I talked to. I mistakenly said Judge Augustus. I meant to say Judge Dave Demers had the conversation with me, and he was the one that thought it would be a great idea for second closure. Just want to make that straight for the record.
Thank you. Anyone else? Heather, let me ask you a question about caseload. The way I would figure it would be how many open cases, total open cases there are in the CPS universe divided by the number of CPS workers you have. I don't believe that we have the number of open cases. We could compute the number of closed, but what would that show?
So that's the number that we would want to look at. We would want to look at the number of total open cases. If we were doing the simplest way to compute how many caseworkers you would need right now to have 15 cases per worker. It's very difficult unless you had people trained walking in the door to ever get to that point. So we continue to find better ways to allow people time to close cases and, work on maintaining the caseloads. And again, it all depends on if we lose people. That's really the most difficult part.
But that pool that this board authorized would certainly go a long way towards evening that out, is that correct?
Yes, that is going to be incredibly helpful, as we've seen already, because our CPS staff person who is leaving today, we were able to use one of those individuals who just completed training to take over whatever cases she's not able to close. So that's how it should work.
Okay. And well, I won't go there right now. One thing that I overlooked is that we've opened a new office in Ogdensburg. It's now staffed. Would you like to comment on that? What your observations were and how the move went and how things are going?
Yeah, so I was able to go over and take a look at the space before we moved in. It's an incredibly nice space, and everyone that I've talked to is extremely excited about being in the community, about being able to work at a remote location. And I've heard nothing but positive feedback, and I think it's going to be a great transition for the staff. We have our home finding unit located over there, and there's space for training and working with our foster parents. And we have one of our child protective units over there that works the west side of the county as well. So other than a few minor details, working out some internet things that are all taken care of now and how we're going to get the mail back and forth, simple things, it's been very positive. Thank you.
Okay. Any questions? Mr. Reagan?
How many employees are over there?
So we have one full CPS unit, which is, I believe, 5 caseworkers and a supervisor. And we have our home finding unit, which is 3 caseworkers, a supervisor. We'll have a clerical staff. I think it ends up being, with a couple of homemakers, it ends up being right around 16 staff.
15?
16.
16. Heather, I just want to thank you again for doing that and moving forward on an innovative project that I think will help bring the services into the community. And I hope it can serve as a pilot project for other communities around the county so that we can serve the people of the county by being there and making our services more available to them so they don't have to travel long distances and go through all the headaches of traveling to Canton every time something's needed. So thank you for what you and your staff are doing, and we appreciate you being willing to make efforts of this sort.
Thank you. We appreciate that, and we certainly appreciate the county administrator and all the work that Dylan has done over there and the board for approving the space. It's going to be a great opportunity for us.
Any other questions or comments? Seeing none, thank you very much. One thing that I'd like to just follow up on that Chairman Sheridan brought up was the additional family court judge. I spoke to Assemblyman Smollett when he was up here last week and explained to him that the supervising judge for the 4th District had been here fully a year and a half ago. And actually, his reason for being here was to scout the building out to see how we could and would accommodate an additional family court judge. He got back to me, he being Mr. Smullen, got back to me here a few days ago and indicated that he will be sponsoring a bill in the Assembly to provide for another family court judge in St. Lawrence County. Now, he's gonna have to find somebody in the Senate to go along with it. I would assume he would be going to Senator Ritchie. But, and if that's the case, I certainly hope that she would be on board with sponsoring a bill in the Senate. But to me, that's nothing but good news. We'll have to wait and see what happens. But we've got a new governor. The governor, although she doesn't get up to northern New York very often, when she does, I think she brings a lot of potential for good in upstate New York if we can take advantage of it. So hopefully this will work out, and Assemblyman Smullen will be able to convince with the numbers, just the numbers here, that St. Lawrence County is in dire need of another family court judge and the staffing to go with it. So that being said, we'll move to Jay Elder.
Thank you, and good evening.
Jay, good evening. The first resolution is modifying the 2021 budget for community services for funding received from the New York State OMH to St. Lawrence County as pass-through funding to Northern Regional Center for Independent Living. Is there by Mr. Smithers, second by Ms. Curran. Jay?
So Northern Regional Center for Independent Living, or we call them NERCL by their acronym, provides family peer support services as a downstream provider. They submitted a late voucher, late being back for their 2020 funds, which, as you probably know, 2020 budget is closed out. So this is a resolution to change the 2021 budget. The money was received from the state. It's still sitting in a deferred revenue account. I reached out to OMH. OMH confirmed that it was expensed on their CFR, their consolidated fiscal report, which is the main report that all providers who receive state aid have to complete, and is subject to audit. So I do have OMH's approval to make this late payment.
Seeing none, all in favor?
Aye.
Opposed? Carried. The second resolution is modifying the 2021 community service budget for funding received from the New York State OMH to St. Lawrence County as pass-through funding to approved agencies. Motion by Mr. Smithers, seconded by Mr. Curran. Jay, go ahead.
So we got our Q4 state aid letter, and again, we had another COLA or salary enhancement for the OMH downstream providers. So this resolution just reflects those small increases for salary enhancements, and hopefully this will be the last resolution to change the amount for state aids for OMH providers.
Questions or comments? Seeing none, all in favor?
Aye.
Opposed? Carried. Jay, you have an update for us?
I do.
Go right ahead.
Thank you. So if you look at the no-show rates, they're going back down for whatever reason, whether it was just had nicer weather in July, but in May we were clinic averages were about 13.7%, jumped a little higher in June to 14.5. It peaked out in July at 16.9, and now we're trending downward. So the average no-show rate for both addictions and mental health clinics is currently at 12.4 for the month. In terms of the counselor visit averages, again, it's been pretty much flat. I mean, we're down 0.3% for addiction services and 0.2% for all clinic services. And weighted face-to-face, we're down a little bit from what we have been. Most months they make the 72% on the mental health side, slightly under this month, 71.5%. I don't really have an explanation of that, given that the no-show rate is also down. There could have been more just last minute, or could have been more cancellations that weren't backfilled. In terms of the prescriber visits, we've had increases across the board. The part-time psychiatrist went from 8.5 or went from 7.9 to 8.5 this month. Our addictions provider last month was 10.39 and went to 13.56. And then our new prescriber on the mental health side, predominantly on the mental health side, who we onboarded several months ago, was at 4.22 last month, and it's jumped to 8.14. The wait list for addictions clinic right now has dropped. It was 23 last month. We're down to 5. Mental health went from 49 down to 29. We are still onboarding some of the new mental health therapists, trying to get them acclimated both to our workflow and also the electronic health record. In terms of individuals served, July reflects a little bit of a decrease from the prior months, in part probably because July was the spike of the no-show rate at 16.9% compared to 13 or 14%. And then also, I think, there was some vacations that occurred with the staff. And, the billed paid percentages, we're kind of trending flat on that as well. In terms of bills paid, we're around 90%. Any questions on the update?
Questions or comments? Mr. Burke?
Jay, I know it's only been a short period of time, but could you tell us what's been done so far for the opioid treatment program?
Well, we have submitted the application to the 3 regulatory agencies, that being OASIS, DEA, and SAMHSA. They've been actually very responsive in terms of, comings back and forth with questions and answers, things like that. So that's moving forward. We've had some, preliminary talks with Buildings and Grounds about the needed renovations that would have to occur in order to make this happen. We've been talking with the specialty team at OASIS. We got some clarity about the use of the mobile clinic as a spoke, you might say, as for the OTP. And we are allowed to dispense on the mobile clinic, but they don't want that to be a delivery vehicle, which I was a little surprised, because if you're in an area, it would seem like it would be easier just to dispense, but those are the regulations. So if we want to deliver, we have to use just a county vehicle, county car. So that was kind of an anomaly. I was a little surprised about that. I've had some correspondence with the coordinator for the docks, mandate for MAT and all the correctional facilities, the state correctional facilities. Right now, we're not in a position, obviously, to sign any contracts because the mandate is coming at us pretty quickly now that it's been signed by the governor. It's likely that the first year contract for the local prisons in our county are going to go to Credo. You know, that may change because I do think that they like to provide contracts with providers that are closest to the facilities. But we'll have to wait and see on that. So that's really about everything right now. I mean, the mobile clinic, we got an email from them. They had a 20% workforce shortage because of COVID over the past few weeks. That, in addition to the supply chain being disrupted because of COVID, we were thinking March. They pushed it back till April, and even that's not a guarantee, but we're still hopeful.
Thank you, Jay.
Mr. Reagan.
Thank you, Mr. Chairman. I met with the superintendents of both Riverview Correctional and Ogdensburg Correctional, and made them aware that our county community services is moving ahead with the MAT program, and told them that, you know, we had discussed with him providing services to the correctional facility. So I'm glad to hear that Jay is in contact with their coordinator. And I do know that the two superintendents were very pleased that St. Lawrence County is thinking about how our agency can be of assistance with them as they meet this new mandate. So, Jay, if you run into any problems, please give me a yell. The two superintendents are very interested in working with you and making sure that this happens. But as you point out, in the meantime, they're moving ahead with arrangements with Credo.
All right. Yeah, thank you. I appreciate that.
Anyone else? Mr. Smithers?
Yeah, I think I'm understanding, but I'd like Jay to clarify, just to make sure I understand correctly, the terms dispense and deliver. When you said one could dispense but not deliver, just to make sure that we understand those terms correctly.
Okay. So if you're dispensing from the mobile clinic, you would actually have what they call an IVAC pump on board. And, you know, the liquid medication in the pump. And then as an individual would show up to get their dose, you would actually pump it from the dispensing machine in real time in the field. If you're delivering, what you would do is you would dispense from the Canton office, put it in prepackaged containers, and then just deliver those to the individuals in the community.
You square with that? Okay. Anyone else? Seeing none, thank you, Jay.
All right, thank you.
Next will be Alexa Backus in the Youth Bureau. And the first resolution is authorizing the chair to sign contracts with various organizations for youth development programs. Is there a motion to move this resolution? Mr. Forsythe, seconded by Ms. Heyer. Alexa?
Yeah, so the Office of Children and Family Services has resource allocation plan funds and revenue available to provide youth development programs. So we have approximately 13 agencies who submitted requests for proposals for the youth development program funding, and that totals approximately $46,500. This is one of our annual resolutions.
Any questions or comments? Seeing none, all in favor? Opposed? Carried. The next resolution is authorizing the chair to sign the 2021 Resource Allocation Plan signature page. Moved by Mr. Sheridan, seconded by Ms. Curran and Mr. Forsythe. Go ahead, Alexa.
Yes, so this is another annual resolution. The Office of Children and Family Services requires that that we submit the resource allocation plan signature page that certifies the approval of the program and grant contracts for the 2021 Youth Development Program year.
Any questions or comments? Seeing none, all in favor?
Aye.
Opposed? Carried. Alexa, thank you very much.
Thank you.
We'll move on to the Office of the Aging and Andrea Montgomery. The first resolution is authorizing the chair to sign a contract with the Community Health Center of the North Country for the Community Friendship Volunteer Program. Moved by Mr. Denisha, seconded by Mr. Smithers. Andrea?
Good evening, everyone. So as the chair said, this is a wonderful new program that's going to be housed in the Community Health Center of the North Country, and it's called the Community Friendship Volunteer Program. And the New York State Office for the Aging has agreed to provide $25,000 a year in financial support for this program that'll be passed through monies to the Community Health Center of the North Country. And what this program is going to do is help us meet an unmet need in St. Lawrence County for our older residents, providing respite services, friendly visiting, telephone reassurance, trips to the doctors, just social visits and things like that. So this program has been in existence for years in Franklin County and has been highly successful. So we're really thankful to the Community Health Center of the North Country for bringing it here in St. Lawrence County. Volunteers sign up and receive training to go into the homes of the older adults. They do volunteer matching. So based on what the older adult and the volunteer is looking to do, they match up the volunteer and the client, and they place the client in the different homes. So if anybody is interested in learning more about how to volunteer or is in need of their services, they would contact Donna Elliott at 315-379-8345. That's 315-379-8345. They have another volunteer training coming up in November, on November 3rd and 4th, if anyone is interested in volunteering. And it can be volunteers of any age, 18 and above. Although as I say that, some of their volunteers do have young children that they are able to bring with them sometimes, of course, following all the COVID protocols, for things like clean out projects. I know a friend of mine who does it in Franklin County. She brought her children and they helped paint a senior's porch one weekend. It's a really great opportunity to involve some younger people as well.
Any questions or comments? Mr. Akers?
So Andrea, the $25,000, how do you plan on expending it? It's not for mileage, I don't believe, is it?
Nope, and apologize, I guess I have a weird camera thing going on right now, so I don't know why it's showing my table and not me. Anyway, no idea. I won't try to flip it as I go, but you can see my Halloween decorations. My apologies. Anyway, so it'll actually be up to the Community Health Center of the North Country of how to use it. They thought that they might use it for volunteer recruitment, trying to spread the word, advertising, and things like that. So it's just pass-through monies. We won't really, other than the state will give it to us, and then we'll give it to the Community Health Center of the North Country.
So it's primarily for advertising and not for any remuneration, because I've been helping Chairman Joe Lightfoot out for 11 years in his elderly state, and I really don't expect any restitution at this time.
Oh my God.
That should fly, I guess, right, Joe?
I can still whip you.
Thank you.
Yes.
Thank you.
Yeah, you're welcome. No, I don't think you can apply for reimbursement, but I certainly encourage you, Kevin, to sign up for the volunteer training if you'd like to be a volunteer, and maybe you could get reimbursed that way.
Okay, thank you.
Perfect.
Are you done?
Just like-
Anyone else? Seeing none, thank you, Andrea.
Thank you very much. Have a good night.
We have to vote on this now, I guess, and I apologize for not doing so. All in favor?
Aye.
Opposed? Carried. It carried, Andrea.
All right, wonderful. I'll look
All
forward
right.
to Mr. Akers signing up.
All right. Next is public health with Jolene Munger. Okay, Jolene, the first resolution is modifying the 2021 budget for the Public Health Department to accept additional funding from the New York State Department of Health for COVID-19 vaccine response. Moved by Mr. Smithers, seconded by Ms. Haggard. Go ahead, Jolene.
Thank you. So this resolution will allow us to accept additional funding for our vaccine response. The original grant amount that we received was for $120,730. So with this grant, it will increase our total amount to $313,036.20. And we're looking to modify the budget to add appropriations to the budget we created for the original grant for our last month. So this will allow us to work on all of our vaccine activities, including replacing our fridge and freezer because our backup refrigerator, we needed to replace that because it was no longer working. So it's allowing us to do some of our work and replacing some equipment that is needed.
Any questions or comments? Seeing none, all in favor?
Aye.
Opposed? Carried. Jolene, you're going to lead us in a discussion with the New York State Fellowship Program.
Yeah, so just a brief update on this. Working with Johnny in HR, we are able to now, instead of having to hire out through a subcontractor or a contracting agency to hire staff, what we're going to be doing is we will be creating new county positions for the fellows, and they will be temporary full-time with benefits. So the one position will just be fellow and another position will be a graduate fellow, and we will have one local coordinator position. And so in order to apply for the job, you will have to go to the New York State website and fill out the application on the state Public Health Corps Fellowship link. And the state is collecting all of the applicants, and then they are filtering them to the county of choice for that individual. It is strongly recommended that you live in the county that you are applying for, but it's not a requirement depending on how close counties are, like where you live. For our county, most likely you're going to want to live in our county because it will be an in-office position. So we are looking to get that process started by the end of this month.
Mr. Reagan.
What are the qualifications for someone to participate in the program?
So for just a fellow, it's a high school diploma. They do prefer to have at least an associate's degree, but depending on the background of the individual, they do look at years of experience. And for a graduate fellow, you have to have a master's degree or be within 1 month of completion of your degree. And then a local coordinator, we're looking at a bachelor's degree for that. It's meant to be for anybody that is retired or just has an interest in public health to try to garner more interest in the public health workforce.
Are we going to be advertising this locally?
Yes, once we get our positions formally created within the county, we will put it out and direct them to the New York State website to apply.
No selection. Okay. Ms. Haggard.
Thank you, Ms. Munger, for your report. I appreciate you being here on your birthday, so I'm sure my fellow legislators will join me in wishing you a happy birthday.
Thank you. Thank you all.
Comments or any questions of Jolene? Thank you, Jolene, very much. Have a great evening.
Thank you.
We'll move to Mr. Soper for the vacancy review.
Yeah, so we have 13 requested positions, all through 5 departments. All 13 of them were approved by the Vacancy Committee this month. That'd be 7 requests on the services agenda, 5 on operations coming up after services, and then 1 on finance later in the month. As of beginning of the month, we had 40 total vacant positions. And unless there's any questions, we'll start first with community services.
Go ahead, Jay.
Yep, this is a request to abolish a chemical dependency addictions counselor and create a behavioral health clinician, which can either be an LMHC, a licensed mental health counselor, licensed clinical social worker, or licensed master of social worker. And that capacity for OASIS is called a QHP. Currently, the requirement is that you have 1 QHP in each PRU, which is program reporting unit, that being the main clinic in Ogdensburg and the main clinic in Canton. We did not meet that criteria, but we were able to get a waiver by splitting different people who had the qualification of being QHPs among the 2 clinics to, I guess, meet the requirement. So we've kind of, in short, we've kind of piecemealed it together. But we had a resignation about 11 months ago. We kept the position in the budget, not really too eager to fill it, but would have gotten our hands slapped, so to speak, from OASIS if we took it out of the budget, particularly during the time of the opioid crisis. So what we'd like to do with that, now that we feel we have some clarity, is bring on a qualified healthcare professional, that being a behavioral health clinician, because we have about 60% of the population that we treat have an unidentified mental health problem, an untreated mental health problem, but really do not want to have 2 counselors, one on the addiction side, one on the mental health side, cost of travel, other barriers of treatment. So they were refraining from getting those mental health services for themselves. Then there's another 20% that are just not wanting that service because of the stigma associated with that. So we're hoping that we can assign people, they call it co-occurring disorder, they call it MICA patients, that have a dual diagnosis, but we'll be able to assign them to this individual so that they don't have to have 2 counselors to get their needs met, and hopefully engage more fully in treatment. Additionally, when we were canvassing the schools regarding the mobile clinic, we had at least 6 districts that were interested in receiving services from the mobile clinic unit. But a lot of those requests were more mental health requests. I'm not saying there isn't addiction in our youth, in some of the districts. Certainly it exists, but there is also quite a bit more mental health concerns being expressed from the school. So we would like this individual, even before being part of the mobile clinic team, to be able to go in and provide what OASIS says is in community services. It's a caveat in the regulations that allows it without having to create a lot of paperwork for a satellite site. So we'd like to do that with this position. Then additionally, there's a certain number of people on the probation caseload. I don't have that number in front of me, but they're being referred to other agencies other than community services, because they do have qualified healthcare professionals that can provide what I would call one-stop shopping for both mental health and addictions services without having to either go to 2 different agencies or 2 different counselors. And I believe that probation would prefer to refer them to us because we do more toxicology tests and we have more fluid communication with the other department.
Any questions? Seeing none, we'll move along to social services.
Thank you.
Thank you, Jay. Okay, Heather?
Yes, the first position that we have is a caseworker. This caseworker position is specifically for our children in need supervision or juvenile delinquents. The position provides foster care and preventive services to children and their family to prevent out-of-home placements, reduce the risk of PINs and criminal behaviors in the home, school, and community, are responsible for case management services, and work intensively with high-risk families, continually assess whether children are safe to remain in their home. The caseworker also talked about maintains state-mandated contacts, assesses for risk and safety within the home, links the family and the child to community-based services, monitors compliance with those services, and makes sure court requirements are completed. The average caseload is the average caseload of 12 cases. This particular worker averaged from 10 to 15 cases and also dealt with probation intakes. Excuse me, this particular caseworker would also be involved in attending court proceedings for children who are identified by the St. Lawrence County Probation Department as potentially coming into the care and custody of the commissioner.
Any questions? Seeing none, the next one,
Yes, so the next position is for a keyboard specialist in the Disabled Client Assistance Program. The entire unit consists of a DCAP agent and a keyboard specialist. And last year, the unit was able to help the county recover $179,769 in interim assistance reimbursements. Even more significant savings occurs by having someone who would otherwise continue to receive temporary assistance for years receive SSI or Social Security benefits instead. The position is normally the first point of contact for the department for clients with disabilities who are applying for supplemental security income or Social Security disability insurance. Position is needed to answer related calls, take messages, schedule appointments, assist clients as necessary, and is key in the new DCAP applications keying new applications into the computer, completing packets, and corresponding with the Social Security office. If this position were not filled, the department's ability to effectively respond to the needs of clients with disabilities and help clients pursue federal benefits as an alternative to temporary assistance would be compromised.
questions, comments? Seeing none, the next one, Heather?
Yeah, the next position is for a employment and training counselor. This position is needed to provide mandated employment and training services to temporary assistance and supplemental nutrition assistance program or SNAP recipients of St. Lawrence County, to assess client skills, to develop individual employment plans, and to make referrals to services and activities. The person in this position is also responsible for providing employment counseling, developing paid and unpaid work experience opportunities, conducting job readiness training, supervising job search activities, collaborating with other educational and human service providers to meet the educational and skill development needs, assisting with funding for training and support services, monitoring medical work exemptions and limitations, moving sanctions and closing cases for noncompliance, providing general employment information and guidance to recipients who are unemployed or underemployed. The position would work with approximately 120 clients, including many who are in need of significant individualized attention.
Questions or comments? Seeing none, the next position, please.
Yes, the next position is for Coordinator of Child Support Enforcement. This position involves the coordinating and administering of the Child Support Enforcement Unit activities and support collection unit activities at the Department of Social Services to help collect child support from the responsible relatives. This help can include locating parents, establishing paternity, preparing and filing court petitions, obtaining support orders, and collecting child support payments. The work of this position includes both coordinating and directly supervising such functions as investigation, unit involvement with family court collections, and financial record keeping. The enforcement and support collection units could not function without this position. This particular individual has been with the department for a very long time, who's leaving us and has provided an incredible amount of expertise and supervision over the entire child support and collection department.
Mr. Akers.
Just a comment that it's really not necessary, Heather, to read off. We have that in front of us. If you could give us a short synopsis, I would be interested in why the individual, like in this case, it's retirement.
Yes.
I would be more interested in hearing about resignations, but we all have the detailed justification in front of us. If you wanted to give us a shorter version, it's not necessary for you to read it all off. Thank you.
Okay, thank you. Yep.
Anyone else? And the caseworker position, we just did.
So this is a Child Protective Services caseworker. As you know, we talked about the average caseload right now for CPS is 24 cases and investigates abuse and maltreatment. This particular worker is resigning due to caseload size and stress related to the job. Is there anything specifically you would like to know about why this person is maybe resigning?
Mr. Forsyth.
Yeah, there's are they leaving to go outside county, or are they going to a different department within the county? Or not sure?
Yes, they are staying within the county. They are not staying in St. Lawrence employment.
Okay, thank you.
Anybody else? Thank you very much, Heather. We'll go to Jolene Munger.
Hello. So I have one vacancy. We're looking to do an immediate fill for our principal fiscal officer. She has resigned to take a promotion within the county. So the principal fiscal officer is essential for all of our state aid grants and helping out the director with making sure overseeing the fiscal staff and department. Just to note, we before COVID had 8 grants. We are now up to 13 grants. We have 5 new ones in the last year and a half.
Any questions or comments? Seeing none, thank you very much, Jolene.
Thank you.
Just as a side note, all of these positions are budgeted positions, every one that we just talked about, just for your information. We go to committee reports. Mr. Akers for the Board of Health.
I believe that the public health meeting for tomorrow is actually canceled.
Thank you. Mr. Sheridan, the CDP Board of Directors.
Thank you, Mr. Chairman. The CDP Board of Directors did meet. They reported that the Head Start is currently running within the budget of 62.44% expended. And after taking into consideration all the recorded expenses and future expenses, they're looking at a little over 100,000 that will need to be spent. They're considering upgrading some of the vehicles such as cars and possibly a bus. Head Start is working on a plan to spend money, so there are no concerns in that department. Head Start training grant is 38% expended with approximately $24,000 left. The money is, it has to be spent by the end of the year, and there are no concerns that that grant will be fully spent by then. The Head Start CACFP showing approximately $8,000 profit, which is coming from the COVID funds. They will use this to purchase some kitchen equipment. And the Head Start ARP grant, about 41% expended. These funds have so far been utilized to purchase 2 buses and 2 Equinoxes. And they are recorded as assets, and therefore they're not reflected in expenses. So there's approximately $247,000 left to spend through December 2022. Head Start CRRSA grant is 66% expended. These funds are to be used for consumables and some contractual through December 2022. There are no concerns at this time with that program. Weatherization-based grants, 39% expended. Halfway through the grant year, there are some expenses yet to be reported. There's nothing out of the ordinary, and things seem to be operating normal there. And CFRs are coming in a timely manner. Weatherization, health and safety is showing a total of $11,841 in expenses. This will slowly increase as units are completed. The cooling program is showing a profit of $21,000. This program has ended, and they will be now starting the heat program. Township budgets are doing well with 93% expended. They would normally be over. But the CARES and food bank grants have helped this year. And so they sent a request to increase their contract amount by $500 to each town, Fulton, Pierpont, and Perrysburg. Their agency balance sheet, they were doing copies of the balance sheet, and it shows that total assets and total liability and fund balances are at $1,358,792.69. That's the end of my report.
Thank you, Mr. Chairman. Ms. Curran, Community Services Board.
Met on October 5th. Claxton Hepburn is looking for a new director of outpatient services. Crystal Simmons will be the person who is doing the interim job. Their children's unit is moving along. Public health, they're offering booster shots at public health every Monday and Wednesday, as well as the vaccine, if anybody wants it. They have SLPC and CNET. They're reporting staff turnover. The program director has resigned and they're looking to hire. Nobody knows anybody that's doing that job. St. Lawrence Health Systems, their site clinics are busy. Their ER consults have gone up. Substance abuse treatment in Governor has increased steadily. Their detox beds are busy. Some of the swing beds have overflowed from COVID, so the number of available detox beds in the CNET and Governor are down. Paxton Central School, all their students are back in school. 10% of their children are in quarantine at any given time, they said. They are busy testing and screening all of the unvaccinated staff. Public transit, there's a bus driver shortage. They had to suspend some routes because of it. Frank is on a panel, and they will be talking at the recovery conference, hopefully to get rides and recovery programs started. They have free rides to vaccination sites. They have 5 buses left to rapid advertising. And addiction services, Sheena Smith, they're working towards dealing with the mandate for the jails that's coming. And that's really kind of it.
Thank you. Mr. Denisha for the Office for the Aging Advisory Board.
Mr. Chairman, we have nothing to report since our last meeting. Our next meeting is November 8th. One thing I would add, though, that the Office of the Aging is now accepting monetary donations for Christmas baskets that will be handed out to home delivered meal clients. If anyone's got any extra cash they'd like to come to the office of the agent, it would be greatly appreciated.
Ms. Terminelli for the Youth Advisory Board.
Thank you, Mr. Chairman. The Youth Committee last met on September 15th. They are increasing their membership. They've had a couple new additions. They still have the goal of 1 to 2 high school students that represent each district across the county. They're looking at Project of the Year, staying in tune with Potsdam's theme of supporting deployed members. So they're looking into a project for that, and then also starting up some holiday themed initiatives. They're looking into a virtual leadership summit that they would hold or host for kiddos across the county, and then a possible Teens for Teens training initiative. And their next meeting is Wednesday at 4 o'clock. The Youth Advisory Board has supported the suicide awareness walk alongside St. Lawrence County Suicide Initiative, or the coalition. And from September 27th until it ends on the 27th of October, there are 75 participants currently at 783,000 steps for a total of 305 miles. So a big thank you and a shout out to the department heads and the different agencies and individuals across the county that have supported this initiative. The allocation committee met and reviewed the applications. There were 14 applications for financial support this year, and all 14 were funded. We are still currently looking for a couple more youth advisory board members. So if you know of anybody that would be interested, you could get the bio data sheet to them. And our next meeting is the 28th at 3 o'clock.
Thank you. And I'd just like to add to that, the redistricting committee. We met with planning last week and actually finalized what the districts are going to look like. Finalize them as far as bringing them before the board for its approval and comment. I will say that we did do some minor surgery with regard to the city of Ogdensburg, the village of Messina, the village of Potsdam, and the village of Canton. And what that did is not affect other than the size of the district population-wise, and perhaps in a couple of instances area-wide, but it brought everybody more into the 7,123 people per legislator that we would represent. One larger thing as far as the area is concerned is that Mr. Perkins and Mr. Denisha, Mr. Perkins was able to shed the town of Clare and give it to Mr. Denisha, and that evened up the representation more in line of what it should be in that 7124 as opposed to the way it was. So there are 100 people there. Mr. Denisha was very happy to get them, and Mr. Perkins was very sad to see Claire go. So we will be bringing that before the board prior to, I believe, the board meeting in November, and to take a look at that and have the board or the committee pass on it. So, if there's any questions? You have a question?
Not concerning that, I did receive an email from Public Health Director Jolene Munger that there actually will be a public health meeting. The reason there were 2 Zoom meetings scheduled, they were canceled. So she's going to send out a new address. I think you'll be included, but the public health will be meeting tonight on Zoom.
Okay. Can you get something on that?
Kevin, is that during the day?
No, it's, was it Joe, 6 or 7 o'clock? I can't remember.
6.
Thank you.
Moving to old or new business, is there any old or new business? Ms. Curran?
So I sent out a copy of the Cuba County Health Report that they send out every day, where they spell out how many new cases they have, kind of broken down, unvaccinated, vaccinated, how many people they have in mandatory isolation, what their confirmed cases are, and then their hospitalizations, and they kind of go down through and say between these hospitals, we have this many people from the county that are in the hospital, and then they break it down by like how old basically people are, like the 90s, 80s, 70s, 60s. So you can kind of look at this and know that there's no pediatric patients in the hospital with COVID, and then it tells us how many, like 20 people are hospitalized, 10 of them are unvaccinated. Just because people have been asking for more information, they want some breakdown as to vaccinated, unvaccinated, might help people do less of this, because unfortunately, people can still get sick even if they're vaccinated, because not everyone is healthy enough to build the kind of immunity that you need, and it's not their fault.
Mr. Chairman,
Yes, ma'am.
if I may ask a question of
You may.
legislator, when did you send that out, Ms. Curran?
I sent it out on Saturday.
Okay.
You want me to send you another copy?
Would you please? And Ms. Fiacco as well? Thank you.
I just think it is helpful.
Thank you
Myself
very
as
much.
I'm just gonna send it to the legislators again, like I did before,
Thank you.
and see if this time it goes.
Okey-doke.
So everybody will get a copy.
Yeah,
All right.
everybody should have gotten a copy last time.
Okay.
Any other old or new business?
Any block here?
Seeing none, we have need for executive session. Mr. Soper?
Yes, we do, Mr. Chair. We'd ask that we postpone it off till after the next committee meeting.
All right. Is there a motion to adjourn? One by Ms. Hager, second by Mr. Forsythe. All in favor?
Aye.
Opposed? Carried? We're adjourned.
I'd like to call the October Operations Committee meeting to order. Asking for a motion to approve the agenda, Mr. Denisha. And a second, Mr. Sheridan. Anybody all in favor?
Aye.
Opposed? Okay, done. I would like to ask for a motion to approve the September meeting minutes, please. Mr. Denisha, seconded by Mr. Sheridan. Is there any discussion? Seeing none, all in favor?
Aye.
Any opposed? Okay, motion is carried. So first we have planning, Mr. Fultonhauer.
Good evening, everyone this evening. 3 resolutions from planning.
Okay, the first one is authorizing the creation of a reserve for public transportation revenue, moved by Mr. Forsythe, seconded by Mr. Sheridan. Go ahead, Mr. Fultonhauer.
Thank you. There are times when we have excess revenue from the bus advertising segment of the bus system. Sometimes that's through bus wrap revenues. And so we're looking to establish a reserve account to make sure that these funds are allocated correctly and that they can be used for transit type activities going forward. So it's essentially the establishment of a revenue account is the intent of this resolution.
Does anyone have any questions? I see none. All in favor?
Aye.
Any opposed? Okay. Second, we have a resolution authorizing the chair to appoint the county planning director as a certifying officer for the environmental review as required by fiscal year 2021 CDBG CARES Grant Award, moved by Mr. Forsythe, seconded by Mr. Lightfoot. Go ahead.
Thank you. This resolution and the next really go hand in hand. They're both associated with a grant that the county was awarded. It's as noted in the title here, a CDBG CARES grant. That's just the name of it. It is COVID related. So the funder, the Office of Community Renewal, which is a primary funder that the county has worked with for a number of years, is allocating some funds for COVID relief. And the county applied through the planning office, applied for some housing rehabilitation funds a few months back. And we were successful. We did receive notification on Friday that those funds were going to be awarded to the county. So this resolution essentially sets up the requirement that is needed to get the ball rolling to get these funds. There's a number of environmental reviews that have to go forward in order for those funds to be allocated. And this resolution sets up that county planning director as the certifying officer to sign off on those forms. And the next resolution will give a little bit more background about the program itself, but that's in essence what this resolution addresses.
Okay. Does anyone have any questions about this? Seeing none, all in favor?
Aye.
Any opposed? Okay. Next up, we have a resolution authorizing the chair to sign a contract with the New York State Office of Community Renewal for a community development block grant by fiscal year 2021 CDBG CARES Award, moved by Mr. Denisha, seconded by Mr. Fay.
Okay, thank you. So just a little bit more background on this grant. It was, again, CDBG funds filtered through a COVID allocation through the state. And the intent is to address housing, or is to focus on housing rehabilitation that is, I guess, that has to do with individuals that are in a vulnerable population category. So there are specific parameters on what these funds can be used for. The goal of this grant is to leverage some of these funds with our lead grant, because some of the applicants that are actually pretty much all of the applicants that would go through the lead program would be in that vulnerable population category. So the intent is to take some of this money, leverage it with some of the higher cost projects that are in our lead grant, and that way we can help expedite or complete that project, as well as use these funds to assist those individuals. There are also funds that would potentially go to other vulnerable populations, like certain seniors, senior categories, children. That's where the lead component would come in, and then others that are directly impacted or heavily impacted by COVID. So going forward, the next steps with this program is we do the environmental review, the resolution we just adopted, and then we'll basically push out advertisement for this new funding round to get individuals that may be eligible to apply for the funds. You'll see additional resolutions coming forward, most likely next month, to set up accounts for this grant, and also to sign an agreement with a subrecipient to do the program delivery and administration for this program.
First, we'll put Mr. Akers.
So the last time with these monies, we didn't have enough contractors to actually do that. What type of actions have you taken or attempted to take, Jason, to remedy this problem?
Good question, Kevin. Still a challenge. We do have some select contractors that are working. We are looking to do some additional training for contractors. We're looking at partnering with Jefferson County to get a sort of a big pool of contractors to train them up. It's really a struggle, not only in St. Lawrence County, but statewide. I was on a call last week with a regional organization talking about housing and the various programs that are out there, and everyone is struggling with the contractor field now. Some actually, I said, do you have any contractors in Jeff County? And they actually they're using some of the contractors that we have in St. Lawrence County to do some of their lead. So is it
part of the problem is the limit to the award? Wasn't the award only $20,000?
$20,000 per unit. We are able to go on a case-by-case basis over that, and we have been able to get approvals from HUD to go over that on some cases, but not to the level where some of these houses are just some of these projects are just way above what HUD would go to. That's why we're hoping that this COVID money can work to address those units.
And the 20,000 wasn't limited, that included actually materials too, correct?
That is correct.
So it's, hardly any contractor is going to take on that job.
Well, with the price of materials skyrocketing as well, yeah, it's a number of challenges for this.
Thank you.
Mr. Forsythe was next.
Yeah, Jason, last week, they showed an episode, an elderly lady with some maintenance around her property and couldn't find anyone in the organization helping. Habitat for Humanity came.
Saw that, yeah.
Would CDB, would they be involved with something like that, or are they kind of left out of this? Or?
Yeah, no, the CDBG funds can be used for that type of work. There are requirements. The income level is one requirement. So depending on the income level of individuals, that sort of directs where we can spend money. It also is always earmarked for, intended anyway, by the funder to go to sort of the the worst case scenarios. So an individual who has some little bit of property maintenance versus someone who has no indoor plumbing, the monies would go to the individual that had the greater needs.
You always feel a little sad for the elderly that was able to do it forever and then doesn't have the resources or the
Absolutely.
ability, and then you're stuck.
And
Thank God these things like Habitat for Humanity.
Right. And these programs, a lot of the clientele, because most elderly are income eligible, that allows us to work with them on these programs.
I just don't want to see them forgotten.
Yeah, no, absolutely.
Mr. Reagan?
Have we done any outreach with City Canton's programs that train young people to get into the construction fields? Some of their alumni may have contracting firms already in existence, but may not be aware of some of the training and some of the opportunities that we're offering.
Great idea. We have had some conversations about that, not directly with SUNY Canton, but definitely something we want to pursue to see what we can do to sort of grow the next generation of contractors that would stay in St. Lawrence County, work in St. Lawrence County to bid on these jobs. So definitely want to pursue that.
I mean, because, we have a great program right here in St. Lawrence County at SUNY Canton that's training young people, introducing them and giving them the skills to work in the field. And I would think that, they would have some graduates that are looking for opportunities, looking for the opportunities to do lead abatement, to do other hazmat, other skills, so that they can be employed right here, because we're constantly hearing about these problems of finding contractors to do these kinds of jobs. And I just think that we need to be bringing our needs together with the agencies that are already producing people in those fields of expertise.
Mm-hmm. Excellent idea. Yeah, we'll definitely look to pursue that.
Thank you.
I wonder if there's, I'm gonna look into it tomorrow. I just got a thought. I'll bet they have a hard time getting insurance contractors for these. And I bet the compensation on what they cost.
There is a course requirement, a 5-day course requirement that's covered by the grant. When we did the training a couple of years ago, we paid for the contractors to do the training. And then there was a further requirement through HUD that they had to get, not sure what all the terminology, but there was an additional accreditation that they had to do that would again, the cost would be covered, but they had to do it. We couldn't require them to do it. So we had 4 that went through the program, 3 ended up being eligible because the one didn't pursue this final certification through HUD. So
I'm just thinking when it comes time for them to produce a certificate of liability saying they do it.
Yeah.
I'd be curious how many have that.
Yeah.
Yes, Mr. Commissioner.
Just a question, Jason. $580,000 grant, and it's approximately 10 eligible income qualified households. That's $58,000.
Right.
Assuming all the money went to the housing, what percentage of the $580,000 grant is used up by administration?
18%. 18% is, it's a little lower. I think 18% is the maximum amount that you can take in the grant. And I think this one is just shy, maybe 17% of that. So that's about Yeah, 20% of 580, so it's a little 75, a little over 100,000 that goes for the administration.
All in favor?
Aye.
Any opposed? Okay. Thank you.
Thank you.
So next up, we have a resolution establishing a foster care resource policy regarding the future placement of children in foster care owned and operated, homes owned and operated by employees of the Department of Social Services. I actually would like to table this. If I could get somebody to do that, Mr. Denisha, seconded by Mr. Sheridan, to the November services meeting, which should give us some time to get a little bit of information back from the Latino people.
Okay, thank you, Ms. Kern. I was just gonna say, could we table it to a point where we have some,
Seconded, yeah, to November services.
would we have information about this by then?
So, point of order,
Yes.
motion's been made to table,
Mhm.
it's been made,
We don't
seconded,
discuss.
there is no discussion.
Thank you, I'm sorry.
So all in favor of tabling this till November services meeting?
Aye.
Any opposed to that? So tabled, I guess. Next up, we have the county administrator's report. Come on over, don't worry.
So we have one resolution on the county administrator's report tonight. Back in 2019, we opened a capital project to do a redesign of the county website. We put down an RFP. It was ultimately awarded to a company named Ego. We worked with them for the next year, having weekly meetings and design meetings. And ultimately, we went live in July of 2020. Throughout that process, something that wasn't really kind of evolved throughout was we worked on an intranet for county employees, a centralized repository for information and documents. Something that kind of grew out of this for no additional cost. That went live earlier this year in August. The county website and the internet provide a new, sleek look. I think we disseminate information in a much more intuitive way. And now that both of these are live, and the project actually came in under budget, we now have exhausted all funds through the last payment of this year's maintenance on the website. But now that all funds are exhausted, we'd like to close the project. We do that by resolution.
So do we have to put one together today? Do you have one?
Should bring it back.
I'm sorry.
I'd move.
Moved by Mr. Akers, seconded by Mr. Reagan. Any discussion? Seeing none, all in favor?
Aye.
Moving on, we have scheduled tentatively for the 27th and the 28th in IT work session. I know there was quite a bit of interest in looking at the county's security protocols and a lot of general interest around IT. So we are going to be scheduling on the 27th, 28th. If you could please send me a preferred date if you would like to attend, either the 27th or the 28th, and we'll get those scheduled and get links set up and calendar invites set up. Other than that, one more item that's back on the desk, if you don't mind, Mr. Chair.
No, I'm fine.
There has been one transfer that needs to be reported to the board. And the treasurer's department, $3,000 was transferred from our rent shortfall account, which we used to pay for areas of rent where it's not assigned to a department, maybe that there's a vacant room or something like that. We've done a good job of closing up some leases and finding places to put the space. So that money has been moved over to the tax advertising fees. This is for advertising costs for the tax foreclosure, the 2021 auction that exceeded the budget.
Okay, that's it?
Actually, sorry, one more. Tentative budget will be presented next Monday at the end of finance. Typically, we don't have an executive session when the budget is presented.
Any questions with that? Seeing none? Okay, I guess we move on to the Vacancy Review Committee. Mr. Sheriff? Dylan? Oh, did you just pop up? Hi, Brooks.
How we doing?
We're doing good. You want to tell us about your vacancy?
Good. So, a little background about, I'll start with the sergeant position. I'm trying to fill a little bit of background. March of 2022, my chief civil officer is retiring. He's informed me. Because of that, we're going to have someone replace him earlier than in March because it's a heavy lift, intensive training for the next person to take over this position. It really should be a year training for this, but obviously with our time frame, I would like to start at January, where he gets at least a 3-month training session with our outgoing chief civil officer. On a sidebar, you'll remember last year I had 2 civil officers where I abolished those positions and made them deputy civil officers, where they were armed and still had police powers. What I'm trying to do here is to change the chief civil officer when he leaves in March and make that position to a chief civil officer, where he'd have police powers, and the new name would be a chief deputy. So he'd have police powers and be armed also, obviously for his safety and the safety of others. And making that new position, it'd be twofold. He'd run the civil division, which obviously has many civil procedures, laws, policies, inner workings, evictions, garnishment of wages, all those things that he would still do. But he would also assist the road patrol with accreditation that we have, with training and some of the police reform duties that we've been handed in the last year and a half. So I'm trying to make that position just not a civil position, but also in the road patrol position. So to get that done, I need to promote latest by January. So he has that training, and I intend on promoting one of my sergeants into that position. Hence, this would open up this sergeant position you see in the vacancy before you. Are there any questions so far about that? Okay. So in filling that sergeant position, a backfill for the chief deputy position, obviously we would need to fill that with a deputy. So the second position you see is a deputy position to fill that sergeant's position that we're going to have to fill. Now, usually we would do this after the position was filled, but the problem I'm having here is that the academy for deputies starts in January, and I know I've discussed this with you before, this group, but it's early January, and with civil service, the way it is, by the time you send out letters of interest and then get background checks and all the things that have to be done now for accreditation and police reform with vetting the officers, that's a 2-month process minimum. Hence why I need to fill this position now and not after the sergeant gets promoted. So that would be the second deputy position. The third and fourth deputy positions are, if you remember last month, I filled 2 sergeant positions in the road patrol. They've been promoted, which leaves 2 vacancies for deputies. And I'm looking to fill those 2 positions in the deputy ranks. And the last deputy position you see in front of you is for a deputy that's going to resign at the end of the year. He's got 21 years of service in. He's decided to resign. So again, because the academy starts in January, I kind of got to get ahead of this position and get this filled now so that I can get someone hired and into the academy. So those are the 5 positions I'm happy to have filled tonight.
Anyone have any questions? Mr. Smithers?
So on our papers, we have 1 sergeant and we have some deputies. They're all listed as just deputies on our paper here. Are you saying that one of these is a chief deputy position?
The sergeant position, you'll see the sergeant position, that first one, that'll be one of the sergeants that gets promoted to this chief deputy position.
In the detailed justification box, there's more information.
Right, you'll see it. It's kind of a domino effect hirings, if you will.
I'm reading the detailed justification, but there's a big discrepancy in the cost for the base salary, and it's the same designation of the deputy on these 4 deputy positions.
Right, well, the sergeant position would be more, there's more salary for a sergeant position than a deputy position.
Okay, or do you want to?
No, I don't see it.
Mr. Chairman?
Yes, please.
Legislator Smithers, are you looking at the one, there's the base salary that says 64, while the others say 42?
Yeah.
Okay.
I'm sure that's in
Yeah, let me take a look at that. Let me take a look at that and we'll get it fixed before the board meeting, okay? And I'm not sure, maybe you may have been getting at before where the authority is coming for the chief deputies, that's not here, but these are being promoted. Do you want to talk about that a little bit, Brooks? About when the chief deputy-
So we're looking to, and Ruth will talk about this more in the budget. I didn't want to get ahead of her, but again, I'm looking to abolish the civil chief position, making it a chief deputy position. Because of that, it's kind of, if you will, if you're in a ranking system, it'd be equivalent to a lieutenant's position at another police department. We didn't want to give it that name, lieutenant, because it's the civil division. So most sheriffs in the state call that position the chief deputy position. You could equivalent to a lieutenant's position, but because of the more requirements and workload for that individual, we're looking to bump his salary up to a lieutenant's pay grade. So that might be the discrepancy you're looking at. That's
Okay. Anyone else have any questions? Seeing none, all in favor?
Aye.
Any opposed? Okay, none, I think we're done. Thank you very much, Brooks.
Thank you. Have a good night.
Now we are on to committee reports. Agriculture and Farmland Protection Board, Mr. Reed.
Madam Chairman, I wasn't able to attend the meeting last Thursday because I was on the road. But the major issue that was brought up, as I understand it, rising dairy contracts are not being renewed for next year. And there was quite a lot of conversation about that. And it led into a conversation regarding upstate Niagara. And seeking a letter from the county urging that upstate Niagara to accept milk that was affected by farmers that were contracts were not going to be renewed by Verizon. So speculating and bringing something forward, hopefully by Monday.
Anyone have any questions for that? Seeing none, on to alternatives to the incarceration board, Mr. Burke.
There's nothing new to report.
Thank you. Board of Trustees for the Supreme Court Library, Ms. Diego.
No update at this time. Thank you.
Okay. On to Emergency Services Board. When I went to NISAC in September, I attended a couple of different presentations on how different counties are addressing their lack of EMS providers. And they are further along in the process of where we seem to be going, where it's hard to get EMS providers. It's difficult to answer calls. They're toning things out for mutual aid more days than not. So I passed on to them all of our information that I gathered at NISAC. I got the PowerPoints from 2 counties and how they put it all together and ended up where they are now, which is a place that actually works for them. So we started a subgroup of people that are going to be meeting to start to see what we can do. One of the biggest problems is, again, the state has mandated just so much more training and hours, and then taking away the number of places that you can go for this training. And I mean, it used to be you would go a few weekends a month and then you did your hours locally. Well, they want people to travel all over, and they had Canton used to do the program, and they got rid of that, and they're trying to get one in Potsdam. But the cost of training is becoming sort of prohibitive, and the really well-paid places start at $18 an hour for paid staff versus the $21 an hour that the McDonald's people are making. There's a lot of training that goes into that, a lot of responsibility, and with some of the newer laws that have been put forward by the state, liability. So, like, if there's something that goes wrong during the ambulance call, I see the look on your face. If something goes wrong during the ambulance call, licensed staff can be litigated against. So people are becoming sort of less interested in the process of being a EMS driver or a EMT or, you know, school, I think, for 18 months to be a ACLS provider now. So people are moving on to other things, and we're starting to take a look at how do we replace those people? How do we make sure that we have ambulance service? One county has a system where there's a fly car with a paramedic on it that can get ACLS care, and a driver that's kind of available through the county. More of the ambulances are staffed with EMTs and a driver. And then if you are more than just a BLS call, basic life support call, they come to you with that paramedic, and they show up there instead of them riding on every rig, just because of the shortages. But this is just the beginning of how we figure out how to do this, and I'm not sure how long the trail is, but if people have questions as this go on, I can get people, Matt Denner will no doubt be involved in this, so I can get people to come and give presentations as this goes. Questions? Mr. Smithers?
You mentioned salary. Is that something that's locked in? I mean, how do we, and you've looked at that, how do we be competitive to those other positions that require less training that are paying more? I mean, is that variable, or is that kind of fixed, that $18 an hour and $21 that you?
It's difficult because the market is kind of varying. Nobody wants to work at McDonald's, so McDonald's people are all of a sudden taking more, but I'll tell you, I've got LPN friends that are like $21 at McDonald's, and we make, you know, so people are going to school for a few years and not making a lot more than what they're paying, or saying they'd like to pay people for minimum wage now. So I'm not sure what the answer to that is. I just know that in 1999, they were excited because EMTs started making like $9 and something an hour. Now they don't make more than, I think, 12 or 13 in the city. So, Mr. Forsythe first, and then Ms. Hager.
We just approved a couple things back on the last agenda. 35-hour work week, 1,800 hours a year, is around $19 an hour for caseworkers.
And they're not out there in the thick of it, I know.
Thank you, Mrs. Curran. One thing that we've done in, not me, one thing that they have done in Potsdam is recruited students from the colleges, and that might be a source. they're here for a few years. They don't do it for a long time, but I know several Clarkson students who served on our rescue squad. So that would be a suggestion. Maybe some of the smaller communities could try to get kids from the colleges who are going into medical field or want to do this later on in life. I don't know if that's a possibility.
Yeah, they're making drives for volunteerism for sure, but volunteerism in general is down
Oh, yes.
overall.
Okay, thank
Anybody
you.
else over here? Anybody on the screen have a question? Okay, seeing none, moving on to Environmental Management Council, Mr. Nelly.
Thank you, Madam Chair. We have not had another meeting since my last report. Our next meeting is on Wednesday.
Thank you very much. Fire Advisory Board, Mr. Denisha.
Thank you, Madam Chair. Our next meeting is actually Thursday evening, October 21st. And we also have a meeting set for Wednesday, October 27th, to discuss the radio communication.
Oh,
So that's a fire service BMS.
yeah. Okay, thank you very much. Inter-county legislative meeting, the last one was the 15th of September. It was a breakfast at NISAC. They talked mostly about broadband and being able to get people service and internet, and God bless you, Joe, and internet service around the state. And they, showed how different counties went about gridding, much like what we're doing with DANK and stuff. So I think we're kind of on that. The next meeting is going to be Tuesday in Lake Placid. They changed it. Normally it's a Thursday meeting, so I got Thursday off, and now they changed it to Tuesday. I won't be going. Jury board, Mr. Sheridan.
Jury board is not met.
Thank you. Planning board, Mr. Craig.
Part of our discussion was covered in the planning board meeting by our planning director earlier in the program agenda tonight. They hit a couple of things we talked about that were agenda items in the town of Morristown, approval of a subdivision, which was basically dividing of a lot, dividing the lot up, and it was really a long discussion over it because of the lot lines. Normally you think about blocking a lot up and cutting that in half, you got 2 equal lots in the whole works, but you would have thought from the pictures that they were making into a jigsaw puzzle, the size of the lines coming down through, and basically it did comply with zoning, I believe, incomplete, but at the same time, we recommended the town of Morristown, I think they should look at the zoning laws if they were going to continue to have lots divided similar to that. Another thing that was for action was the comprehensive plan for the city of Ogdensburg, which we're going to do in the future. And really, the main recommendation that I think came out of this sort of discussion anyways, was maybe they should look at, they wanted to review it every year. We thought that may be an awful short time for a comprehensive plan to review. Jason, can you think of anything else that should be highlighted from that?
It's okay, sure. Yeah. Sure, just maybe one other comment with regard to the comprehensive plan in Ogdensburg. The county planning board recommended that an implementation matrix be put together because there were a lot of great ideas in the plan, but there was not really an identification of what they wanted to do first. So that will make it a lot more, I think, manageable if they identify how to prioritize what they want to do in the plan. And I think the last recommendation of the county planning board was, condition was the idea of adding a mapping component. So everything that was mentioned in the comprehensive plan could be tied out to a location. So people looking at it would know where the various locations were for projects.
And adding to discussion, the discussion went on about broadband too, where basically we had the survey, we paid for the survey, and what's going to be done, I think that we planned out was at 2016, and we're going to have broadband to everybody. And one of the points was made by a resident of the town of Louisville, we're talking about that, said that Hughes said that basically they had established broadband from the clouds for the town of Worcester and other areas in the county where they said, no, it wasn't really there yet. And I know myself that the property that our family owns in town of Colton, and we're in a position too, the spectrum says they're there, they're not there yet. Who says maybe they're there, and one of the things is that our broadband is the cost of it. Basically, a discussion went is, some of this cloud stuff says it's gonna be 40% cheaper than our, basically our cable broadband to our homes. So I think that we've gotta come a little further than what we've done as a county by just simply saying, we know where there is not, 10% of people don't have it, but what are we gonna do about it to make it happen?
Anybody have a question about that? I have one question about planning. Someone called me and asked me what they were gonna do with the, gas station, or actually it was at Tim Hortons and a subway that burnt in Morristown, and they wondered if it was gonna be able to be rebuilt because of the way it was situated.
To be determined.
To be determined, okay, thank you. All right, so now we're on to old business. Anybody? We have the screen, new business. No one, okay. We have a need for executive session for?
We have a need for litigation, personnel, the medical, financial, credit, or employment history of a particular person or corporation, or matters leading to the appointment, employment, promotion, demotion, discipline, suspension, dismissal, or removal of a particular person or corporation, and negotiations and appointments.
Okay, can I have a motion to go into executive session? Oops, sorry, somebody have a question? No. Okay, motion to go into executive by Smithers, seconded by Denise. I have a motion to adjourn by Denisha, seconded by Reagan. We are adjourned.